Welcome. I'm Julie Moose. I'm Executive Director of the National Press Club Journalism Institute. I'm really happy to be here with you and with our panelists and moderator on behalf of the Institute and on behalf of our partners in this program, the National Press Club Communicators team. And so thank you for being here. We expect a big group today, so we're excited that you're so interested in this, and we're going to get started right away. Excuse me. We hope that you'll join in this conversation. We are very interested in the questions that you have and in making sure that we're facilitating getting you the information you need, excuse me, to communicate reliably and report accurately. So please do start asking your questions in the Q&A queue anytime. We'll be taking them throughout the program. So I'm really happy and honored to introduce Alison Fitzgerald Kodjak, who is investigations editor at the Associated Press and also a past president of the National Press Club and a board member of the National Press Club Journalism Institute and an exemplary journalist who will be facilitating a very interesting and important conversation for us. So with that, I will turn it over to you, Alison. Thank you.
Thank you. Thank you so much, Julie. And thanks to the Institute for putting this together. Our country is about to, or is in the process of launching what is going to be the biggest vaccination campaign in our history. And it is, for anybody who has lived through the last year knows, hugely important that a large, if not overwhelming, percentage of the US population does get the vaccine. And but there are a variety of challenges around this, and we are here to talk about how to recognize those challenges, understand them, and communicate about the vaccine and the vaccination campaign. We have a really great panel here. I'll start by introducing them. We have Jesse Holland. He's an assistant professor of journalism at George Washington University, an author, a scholar, and an expert in African American history. We have Nick Sugai, who is vice president of the Ad Council, which is leading a national public education campaign to encourage people to get the vaccination. And finally, we have Susan Winckler, who is the CEO of the Reagan-Udall Foundation for the Food and Drug Administration, which has done public opinion research on the vaccination. I'm going to start over here with Jesse. What are some of the obstacles to vaccination among communities that have historically had reason to distrust the medical community? Can you talk a little bit about what you know and what you've seen?
Well, what we know already is that communities of color and minority communities in the United States already before the pandemic were having problems with the medical industry in the United States, both currently and historically. We know of events like the Tuskegee experiments, where communities of color were experimented on for and by our government, leading to a huge distrust of government medical programs. And on top of that, we also know of private abuses of minority communities by the medical industry. One of the books about that is The Immortal Life of Henrietta Lacks, where we see communities of color abused and taken advantage of by the medical industry. And even more recent, we've heard discussions of how African-American women and African-American patients their pain thresholds are being ignored by the medical community. And we've even had people like tennis superstar Serena Williams talk about how difficult her pregnancy was because her doctors wouldn't listen to her and wouldn't believe her when she told them she was in pain. So there is a long time and deserved distrust between minority communities and communities of color and the medical industry. So now when the government comes and says, you need to take this vaccine that looks like it's been rushed through the approval process, and we want you to take it first, then you get that distrust. So it's very hard for people in the communities of color to immediately accept that this vaccine is the right thing to do, which is why we need to have extra way to reach out to these communities and have some trusted partners talk to them about the necessity of this vaccine, because history tells us that communities of color always get the short end of the stick when it comes to medicine. So it's going to be hard for people to believe all of a sudden that that history doesn't count anymore, and they should just take the word of doctors and of the government that this is something that they should do.
It's interesting that you point out that they are people, the communities of color, of those who are asked to take this first, because that's the people, the frontline workers are disproportionately from communities of color and probably are most at risk for the virus, as we have seen in the last year. But that's an interesting dynamic. And Susan, I'd like to turn to you, because you've done the polling on this, the research on this, and it's not just communities of color, and I'd like you to talk about that, but there's also this historic vaccine hesitancy that runs through our culture. Can you talk about what you found in your research?
Absolutely, and thanks, Alison, for the opportunity to be here today. So at FDA's request, we convened listening sessions with traditionally underrepresented communities and essential workers. And it was really a listening opportunity. So we sat down in these communities and said, tell us what you think about a COVID-19 vaccine. And we heard three themes. The first was, how could the vaccine possibly be developed so quickly? Like, just how could that be done? And then another concern about the vaccine development process, that it might not work for me. The second main concern was about the review and the authorization, that this distrust of government, how, what generally we have a distrust of government, and then a concern that economics or politics would be prioritized over it. So you have those two challenges with the vaccine process. And then the third was, as Jesse, just reminded us and illustrated for us, the historic and current structural defects in the healthcare system just animate this situation. So they're thinking, all right, there's disparities already, and I don't trust this system. So we found that in the essential workers and in the traditionally underrepresented communities, that they wanted more information. They wanted to better understand it and to learn more, so that then they could make a decision about whether or not to use the vaccine.
And so, Nick, I'm going to turn to you, because the Ad Council is planning to do a messaging campaign here. What is it that you think you can say that will sway these communities of color and others who are hesitant to take the vaccine?
Yeah, that's a great question. To your point, we are building and mobilizing, one of the biggest communications efforts in the history of the Ad Council. We've been around for more than 70 years. We've done campaigns from Friends Don't Let Friends Drive Drunk to Only You Can Prevent Forest Fires. I think we see this as one of the biggest communications needs and efforts of our lifetimes, really. And I think, to Susan's point, so much of it is about giving people the information they need to address their concerns and questions. So as we think about it, it's really not about persuading people to get the vaccine. I think we've seen, we've done research, and I think what we've seen is people are desperate to get beyond COVID-19. People want to get to the other side of this. And I think everybody realizes that vaccination overall is one of the key steps that's going to get us there. What it boils down to is, doing good by yourself and your loved ones. And is getting the vaccine going to be safe for you? Is it going to protect you? And a lot of it's about protection. But so much of it is about people having questions and wanting information. We've done a survey recently. 40% of people in this country don't feel they have enough information to make an informed decision about the vaccine. And when you look at communities of color, that gets up to 60% for Black and Hispanic populations. 60% of people don't feel like they have enough information to make an informed decision and be confident about getting the vaccine. So I think one of the biggest things that places like Ad Council can do, and really everybody, is just get people the answers to their questions and get information out. And how can we connect them with the medically vetted, scientific and proven information that will help alleviate some of their concerns and questions.
Those are some huge numbers. When you talk about the number of people who are concerned, who are hesitant, who don't know it, don't think they have enough information, it's much higher than the hesitancy that we see across the country for childhood vaccines. I would love to hear from you all if you have any sense of how much of that stems from the political discussion during the campaign in the fall, where there was this push to make sure we got the vaccine done, but then there's this concern about whether it was too fast and the push-pull in the political debate. Let me start with you, Jesse.
Well, we come in already with a problem there was already a push against childhood vaccines from a segment of the population, even before we needed the coronavirus vaccine. So you're running against, already starting against a headwind of people who erroneously believe that childhood vaccines can cause autism, that the government's trying to implant microchips in your body, and all of those other conspiracy theories that are against vaccines, period. And then add on top of that the political controversy that erupted over coronavirus, where for a good portion of the year, you had a large part of the population saying, oh, this is just like the seasonal flu, or that this is something that will go away when it gets warm, or this is something that doesn't exist at all. So of course, if it doesn't exist, why would you need a vaccine for it? So this whole effort began with two strong arguments in a population in the United States who were against it to begin with. Now, hopefully, now that we've moved forward into the future and into in a few days a new administration that will say strongly that these vaccinations are needed, that coronavirus is an awful thing, hopefully some of those arguments will be muted from the highest levels. That doesn't mean that they're going to go away. But if it's not being pushed from bully pulpits, from the presidential and the gubernatorial level, hopefully that will at least change some of the people's minds out there about whether this vaccine is needed or not. Now, I want to be clear that I don't want to make it sound like that it's only minority communities who are against this vaccine. There are a lot of people in this country who are uncomfortable about this vaccine. But now, hopefully, some of the political headwinds that made people think that this vaccine was either not necessary or not wise for them to take, hopefully some of those political headwinds will die down some, and there will be some people who can make an informed decision now about whether they want this vaccine or not.
Susan, can you talk about from your research, how much of this goes to the speed with which it was approved versus the political debate?
So both were very strong, but I'll say it was not only the political debate, but also the economic and the financial debate. So, a concern about, is the priority going to be, we have to open up our economies. And so that's why we're going to perhaps have a challenge with the governments and that the federal government might rush approval. So they were a nearly equal tension on concerns about the speed, and then concerns about who's making this decision and what is their top priority. So thankfully, we've confirmed it's career. It is career public servants. It is scientists. It is physicians who made the decision at the FDA, and did it based on science. But I want to mention another piece that to build on what Jesse had said. Part of the challenge we have here, though, is that in communicating about science and early in the pandemic, we were very definitive and confident about what it is that should and should not be done. And probably should have been a bit more humble in, we're learning about this virus and we're learning more, and help people understand that what is the guidance today might change tomorrow or in a month or in 3 months based on what we learn about the virus. So we've got a bit of humility in saying, here's what we know. And so what we know today about the vaccine is it was approved based on the science, but we're also now continuing to look at that science and what's the performance of the vaccine in the population. And it will be important to continue to share that information about what is it that happens when you get vaccinated, and help communicate that back to people so they understand what to expect.
Yeah, and I would say as journalists, that was an interesting dynamic. It's the scientific community was learning as we went through this. What we would hear from them would change. And, obviously one of the most famous was whether or not to use masks. How much do you think the changing guidance on mask use and mask effectiveness affected what's happening now?
That certainly did come up in the listening sessions about, I'm kind of buffeted by what I hear. I heard one thing one day and another thing another day. And so what we observed is that it did matter. And we have to recognize today we don't know everything that we want to know about the virus either. And so continuing to acknowledge that this is based on what we know today, and we're going to continue to learn, and we want to adapt the guidance based on what we learn.
Okay. And Nick, I'd like to talk to you a little bit. One of the lines of reporting that we at AP did this year, along with Kaiser Health News, was the fact that the public health community was sort of ill-equipped to deal with the virus. And now those same people are saying it would normally be their job to do a lot of outreach to the community, advertising, knowledge campaigns. If they are unable to take up the slack, I know the Ad Council is hoping to do a lot of that. Is that a huge loss? Is that where do you go?
Yeah, I think it's important that people hear from a lot of different places about these vaccines. And that's one of our main points of emphasis, actually. We're doing our traditional Ad Council campaign. We're looking to reach people through advertising, communications, and media. But we're putting a big emphasis on kind of the ground game too, and equipping state and local health departments, the public health community at large, with really all of the learnings that we're getting, and as much as we can give them in terms of communications to help inform their efforts. And what we've seen from research is people really trust a variety of sources. And just as important as the message is, who is the messenger? We know that medical experts and doctors are still very trusted. Institutions like the CDC are still trusted. And then within local communities, state and local departments of public health are very trusted as well. We're also doing outreach to, the faith community. We know that pastors and faith leaders are very trusted. And we want to make sure that people are getting the right information from a variety of sources. And certainly, yes, community health centers. We know that access is a big issue, and we want to make sure that really everybody who is talking to people about this is equipped with the right information.
So you work with local health departments and healthcare centers, because we have found that they have told us they're very stretched. Are you supporting them, or are you outreaching through them?
Yeah, so we're actually making our learnings and insights open source to public health officials. We're actually holding a summit webinar next week to share the latest information and learnings that we have. So I'd be happy to share that as a follow-up after this. And I think we're really trying to be in coordination and have everybody working from the same messaging strategies as much as possible.
And one thing that I'm struck by, as you mentioned, your older campaigns that are so familiar to us, is that those slogans are things I heard on television. And now people are watching Netflix and not seeing ads, and getting their media through YouTube and Twitter and Facebook. How do you change that strategy? And I want to ask you that question, but then I also want to go to Jesse, if there are specific ways to reach communities of color in that. So Nick, tell me, where are you going now if it's not ABC?
Certainly, it's a great question. The media landscape is a lot more fragmented than it was even 10 or 20 years ago. But I think we are certainly approaching it from all angles, digital and social, along with television and radio. Like I said, messengers, it is a key piece, and messengers can appear in a lot of different formats, and even locally as well. And the other thing I'd say is, the strategy of how to message to people probably doesn't change even with, the media type. What we've seen is kind of the right formula for this is leading with the fact that it's okay to have questions. So many people have questions, and that's a real thing. I think most people don't understand all the intricacies of how this vaccine was developed or the vaccine approval process, and they want to get the right answers for themselves and their families. So leading with empathy for, having questions, it's okay to have questions, pairing that with just reminding people that, the vaccine is what's going to help us get to the other side of this. And so many people have the moments they miss, whether it's being with family and friends or just being kind of out in their communities. And then equipping people with information and really empowering people to feel like they can make an informed decision at the end of the day.
Okay. And Jesse, can you sort of address the method of outreach that would be the most effective in your mind?
Right, Alison, as you know, and as all of us know, that the reading and viewing and listening habits of Americans have been extremely fractured.
Yeah.
Especially over the last 20 years. I mean, you and I are pretty much from the same generation. Alison, we grew up with Schoolhouse Rock and The One to Grow On, where you could put a public service message in certain places and you would be relatively sure everyone would see it. Mm-hmm. But now there are so many different places people go for news and entertainment. Like you said, in the past, we all had ABC, CBS, NBC, PBS, and that was it. So you had 4 networks that you could put a public service message on, and you could be sure that you would get just about everyone. There was only a few national news sources. You only had New York Times, maybe the International Herald Tribune, perhaps the Washington Post and the LA Times. But now everyone watches something different. With the flourishing of cable news networks, news websites, and an increasing push in ethnic media. A lot of the people that we need to reach in any national campaign are not reading the New York Times. They're not watching ABC News. They're not watching NBC. They're not watching Fox News. They're watching a million different things. So this is showing us that we need to diversify our push to inform the American people. We cannot only go to the same sources that we went to 20 years ago. We have to search out shows like The Breakfast Club. We have to search out shows, channels like Netflix and ask them, will they do their part? We have to go to places that we never considered 20 years ago to reach people who aren't watching those anymore, especially when it comes to communities of color. There has to be a push in ethnic media to get the word out to people who are not reading and not following mainstream media. We have to go to the Black press. We have to go to the Hispanic press. We have to go to the Asian press. We have to go to the Native American press. These are the organizations, these communities not only are reading, but they're the ones that they trust. The people who are from their communities. We have to learn to move away from our old formula of just talking to the mainstream media and go to organizations in which these communities are invested in and trust if we want to reach the people we need to reach.
And Susan, I noticed you went off mute. Do you want to jump in here?
So what I wanted to add is that we also need to go beyond media. So we also tested who are the messengers who should answer questions about the vaccine, and celebrities were dead last. Wow. It was my doctor, my nurse, my pharmacist. So my healthcare professionals, that's who should answer questions about the vaccine, and it was a 70-point spread from them to celebrities. So celebrities and broad announcements can be really helpful in raising awareness. But if I want to know, how did they get the vaccine, to the market so quickly? Or am I represented? Well, it works for me. That's not a question that's answered in a quick soundbite. It's a conversation. So it's allowing individuals to ask the question and then having the right messenger to answer the question, a health expert, a local health professional. And then, we did find too, like FDA could be trusted for some of those answers, but it's this multifaceted approach.
Well, so you raised a few things in those two answers that I want to touch on, but one of them is that we did actually have exactly that question that you answered in the chat, which is how important are nurses, doctors, and community leaders? But then there's this other, you mentioned celebrities, but there has been this movement by politicians and others to go and publicly get the vaccine and talk about it. We had members of Congress doing it. We had former President Obama doing it. We had Vice President Pence doing so. Is that effective, and is it important? And separately, should Chrissy Teigen be doing that, even if she's not talking about how it was approved, but saying, "Look, I did so." Like, are those approaches, and is that kind of public, I got the shot, important?
I'd say from what we're seeing from Ad Council, it definitely is. I would agree with everything Susan said about who are the really trusted messengers for medical information. But I think at the same time, it's important to build, a cultural consensus around the vaccine. And I think it's important, so many people, one of their main concerns is they don't want to be the first one to get it. So as much as, politicians can kind of back up what they're saying and get it, be at the front of the line to get it within their eligibility windows, makes a difference. And, even for celebrities, our research finds the same thing, that celebrities are not trusted for medical information. But people seeing that other people are out there in the world getting it makes a big difference. So much of the discussion around, clinical trials and how many people have gotten this is around, numbers in the thousands of people who've got it during the earlier clinical trials. The reality is that at this moment in the United States, 9 million people have gotten the vaccine already. So anyone getting it from this point forward, you are the 10 millionth person getting it. There have been lots of people who've gotten it, many of whom are doctors and nurses and medical experts. Frontline healthcare workers are at the head of the line to get this. And in framing it, things like that to kind of reframe these narratives about people worried about being among the first to get it can make a big difference from what we've seen in just shaping opinion.
And Alison,
go ahead, Jesse. Go ahead.
Let me jump in here real quickly. I'm from a small town in Mississippi called Holly Springs, Mississippi. And I can tell you that a lot of people who are from small towns, first of all, they have to go to the big city to get to the doctor because there are no longer doctors in their small towns because of the medical crisis. So the people that they trust are not doctors, are not politicians. They trust the people who live in their towns. They trust their community leaders, and even more so, they trust their religious leaders. I can remember back in the past where information about flu shots, information about childhood immunizations, they came from behind the pulpit, from the people from the ministers and lay people that the community trusted. Somewhere along the line, we're going to have to engage the faith community in some shape, form, or fashion to get messages out to people who are watching television and seeing the vice president and seeing the president-elect getting immunized and saying, we don't know what's in that vial that they're getting. We don't trust politicians. Mm-hmm. We need to go to the people that the people in small towns and rural America trust. And that's their local community leaders, and that is their local doctors and nurses, and that is their local faith leaders. Those are the people who will be able to make a difference and change people's minds, not someone they're seeing on television, seeing on YouTube, or reading in the newspaper.
Now, it's interesting. I'm hearing two sort of slightly different things here, which is that there is a need for hard information, that people want good information about the vaccine and its medical properties and the fact that it was well vetted, and they want that from their medical professionals, their doctors, nurses, and pharmacists. But there's also this need for influencers, be they celebrities, politicians, or local leaders, who won't be the ones who can give the hard info. But I mean, should we be training pastors and local members, like local council, city council members, on the correct information about how the vaccine was approved? Like, that seems like a huge amount of responsibility to put on people, but you also want to make sure people are giving the correct information. How do you do that? Like, whose hands do you put that in?
Yeah, I think what I would say to that is it may seem like two things. I think it's really, equipping people who have that platform, either at a national or local level, to help facilitate those conversations. And I think thinking of it more, this is not top-down information, really. This is conversation and dialogue, because people have real questions and real concerns, and it's really a two-way dialogue. Questions and information and response, and feeling like you're getting what you need to make an informed decision. That can happen at a national level. I've seen, on YouTube and other social media places recently, Dr. Fauci and other experts joining influencers and celebrities for conversations about the vaccine. And that can happen at a local level as well. So with faith leaders, community-based organizations and leaders, having a local community health worker or doctor or expert have a conversation with the community, and then having a forum or town hall, whatever it may be, to really have an opportunity for that dialogue about people's real questions around this.
Now, I have a good question from one of our viewers here. It says, many African Americans have lobbied to be first in line for the vaccine because of the disproportionate effect on that community. What do you think is the right way to approach this? And what do you do about underserved communities? Well, and I know there was a debate about fairness and equity being central to how to roll out the vaccine. Can you go ahead, Jesse?
Well, I mean, first of all, I have to say up front that understand that there's no minority community that's a monolith. Right. So you're going to have different people within the community with different ideas about the vaccine. So there will be no one size fits all solution to any of this. There were quite a few people during the rollout and the testing of the vaccine who warned that there needed to be more minorities in the test groups to make sure that the vaccine would work for everyone. But just in the same way, there are quite a few people in the minority and frankly in the non-minority community who distrust all vaccines and don't want to have their children vaccinated and don't want to go get their annual flu vaccine. There will be no one size fits all solution to any of this. We just have to find a way to speak to people who are willing to listen and willing to have the conversation and willing to perhaps change their minds and move forward if given the information that they need. There will always be some people who you're just not going to reach for whatever reason. And in fact, I've been told by several of my friends and colleagues who've gone to their doctors and because of their underlying condition have been warned by their doctors not to take the vaccine because it may conflict with something a life-saving medicine they're already taking or an underlying condition that they already have. So we're going to have, while we want to speak to as many people as possible with the same message, we are going to have to understand that the same message isn't going to work for everyone. And we need to find a way to speak to as many people as possible as a group. And sometimes we're going to have to speak to people as individuals to make this work.
Now, one of the things that we have found as journalists, and I have a couple of questions in the chat about this, is that there's a lot of disinformation out there. You all are talking about spreading a positive message with data about the vaccine. And, one of the things that we've learned in recent years is sometimes data doesn't sway people. So how do you dispel these conspiracy theories and disinformation without perpetuating them? Or are there just, as you said, a lot of people who just aren't going to be convinced? I mean, how, as a communicator, as a journalist, do we do that?
Well, it's very hard to knock down an argument you can't repeat.
Exactly.
Because you're afraid, you're telling people of that argument.
Yeah.
But sometimes the only way to fight bad information is to provide good information and say, this is the bad information, don't do this. I mean, we can't just ignore bad things and say, okay, if we don't say anything about it, then nobody will pay attention to it. I mean, that's why we have poison stickers on poison. We're not saying, look, 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 this is poison. We're saying, hey, this is poison, don't drink it. We do have to acknowledge the bad information out there. We do have to not acknowledge the disinformation out there and say, here's the correct information. Unfortunately, you then are saying to people, now you have to make a choice to believe the good information or the bad information. But we can't just ignore disinformation and misinformation anymore, especially about these important topics. If you do, especially with social media, that will just allow the lie to get around the world before the truth puts on its shoes.
Did you want to jump in, Susan?
Yeah, I was going to underscore in one of the messages that we specifically tested, we found that saying that career public health officials and scientists were making the decision about whether or not to approve a vaccine, we had to put in the phrase, not politicians or their appointees. So we had to wrap around the message to say it's the scientists and it's not those other folks. So sometimes you can wrap it around the message, but it's important to acknowledge. And Jesse, I'm going to borrow your running around the world line.
And I would just add to that too. I think in terms of misinformation and disinformation, you know, from the Ad Council, we're partnering with some great places. Public Good Project is one that really has their finger on the pulse of the online conversation. And I think it's important to build in, we don't know, you know, a month from now, 2 months from now, what is going to be the line of question that may emerge. But it's important to build in mechanisms to have, you know, real-time conversations with people in this larger model of, you know, a dialogue about the vaccines. And I think the other piece too, I would say, is so much of the narrative is about, is it safe? How much can we change that to a conversation of, is it worth it? Mm-hmm. Because the alternative to not getting vaccinated is right now more than 3,000 people a day in this country are dying. And that's the reality. So safety is a huge factor. The other factor is protection. And that's something that people really care about a lot, protecting themselves and their families. The conversation really should be, is it worth it? Let's get the information we need about the safety and let's get the information we need about protection and then make an informed decision that we feel really good about.
So as a journalist, though, I mean, I can see the challenges in writing stories about risk-benefit analyses, even though, like, I understand what you're saying, but, you know, you write something like that, like, well, if you don't get the vaccine, you could get the virus, and then you could. And through the year, we've been trying very hard to explain that a lot of people get the virus and most people don't die, but many get quite sick. Then people grab onto the most people don't die, you know, and so I'm sort of picturing this trying to say, well, if you get a vaccine, that's an active choice. There hasn't really been a lot of risk shown there, but people believe the word of mouth. You know, trying to put a risk-benefit analysis into every story just seems like a huge challenge, at least for journalists. And Jesse laughing, he was a journalist.
I certainly that is 100% true. And I think it's, you know, where possible, focusing on, yes, the emerging problems, but also, you know, the good things that are happening. And I think some people in the chat raised kind of the I voted sticker.
Yeah, that was
the beauty of something like an I voted sticker, which, you know, we are hoping to be part of our campaign, something like that, is it takes these moments that otherwise are not notable. You know, someone walking in and voting, it's not necessarily newsworthy, but it gives a platform to spreading something that's positive, and wouldn't otherwise really be a story. So we're looking for ways to yes, there will be people kind of latching on to the issues and problems that are arising, but as much kind of elevating and amplifying the great things that are happening as part of this as well.
And Alison, let me just add in here that we also have to be able to understand who we're communicating with when we talk about getting the media involved in things like this, because we have to understand that it's not a reporter's job to advocate for people to take a vaccine. That's not what they do. Their job is to go out and see what's going on and report accurately and fairly what they actually see, discover, and can prove. We need to aim any vaccination advocacy efforts toward columnists and communicators and commentators and editorial boards. Those are the people who have the ability to say, hey, this is a good thing versus this is a bad thing. It's not hectoring a reporter to write a story about, hey, you should go out and get a vaccine. You're never going to win that battle because that's not their job. You can tell them, come see us vaccinate people, and you can talk to people who have been vaccinated, but you can't ask a reporter to go out and write a story about this is why people should get vaccinated. That's not their job. We have to aim those messages toward the editorial boards and the columnists and the commentators and the analysts that we see on these television shows. Those are the people who can say that you should go out and get a vaccine. It's a reporter's job to say there are X number of people getting vaccinated and here's what they said about it. So we're wasting our time trying to tell reporters to tell people to get vaccinated. We should go after their editorial boards. We should go to their columnists. We should go to those commentators on the 24-hour news channels and say, hey, this is what you should say. We have to understand what each role is in the media, and we should honor those roles.
Oh, bless you, Jesse. Thank you. Susan, so one of the things on that, like we go out and talk to people who've been vaccinated. One of the things I'm hearing, but with no real sort of survey or polling rigor, is these sort of rumors. Oh, when you get the vaccine, you're sick for 3 days after, or you get the vaccine, your arm hurts for weeks. Or, the vaccine can cause the disease. But there's been no evidence of any of that I have seen reported in the scientific literature. Is it your organization's role, perhaps, to do those kinds of surveys, and do you have those plans?
So we don't have them planned.
You're on the spot, didn't I?
Yeah, exactly. But it is that type of, one of the things that we do know is that when people understand side effects, whether from vaccine or something else, and you're prepared for it, being prepared is like, oh, okay, that's okay. It's the fear that can sometimes magnify what it is that happens. So should you expect to have a sore arm? Yeah, like that we know. You should expect to have a sore arm. Can you get COVID-19 from getting the vaccine? No. And that, scientifically, those are two things actually scientifically that we know. Your arm might hurt, but you won't develop COVID-19 from the vaccine. Then we're continuing to monitor, and we'll get more information about what is it that you can expect as side effects. And so that's where it's important. We gathered some of that information in the clinical trials, but the people who are getting the vaccine now are asked to report the information so that we can continue to gather that information as we get to the millions of people who are getting the vaccine. What are you experiencing so that we can share that with others?
And let me just add in on this conversation that I can predict right now, since I'm no longer a reporter, I can predict this since I'm a commentator on this program. I can predict right now that somewhere in the next year, there will be one person who unfortunately dies, and someone will say it was because of the COVID-19 vaccine. But as Nick has already told us, more than 9 million people have already taken the vaccine with no side effects whatsoever. But when that one person or that one person's family blames the COVID-19 vaccine, it's going to be blared across every news channel. It's going to be on every Facebook post, every Twitter post, people saying, see, we told you the COVID-19 can kill you. And here's one person who died. We need to be ready with data and facts to counteract that story, because that story will be played everywhere. They're going to be screaming it from the top of their lungs that see, we told you this was dangerous, when we already know millions of people have taken this vaccine with no or little side effects. And we won't know even then whether it was the COVID-19 vaccine that caused the death. But knowing the media the way we do, I can almost guarantee you that's going to happen sometime over the next year. And we need to be ready with facts and scientific data. And frankly, just like Nick said, the risk analysis to tell people that this is still worth it.
So I just want to mention to everybody watching here that if you do have questions, please put them in the chat. We'll get to as many as we can. We have about 10 more minutes of discussion here, so we'd like to hear from you. In terms of how the vaccine is distributed, it's been a bit of a rocky start. It's a huge campaign. Some of that's quite understandable, but it's also been criticized as sort of reminiscent of what happened with testing early on. Does that impact people's view of the efficacy of the vaccine, anybody? Or is that a completely separate thing? There seems to be a lot of people who want the vaccine who can't get it yet and not sure how to go about finding their information. Susan?
Yeah, I don't think we've seen anything that says that you have like less trust in the efficacy of the vaccine because you can't get it. But it is that teachable or actionable moment, and when you lose those, I think that's what we regret and are trying to fix in the distribution system. So if you're in the priority group and you're motivated to go, let's capture that versus saying, hold on until later. So we're not seeing the connection to concerns about the efficacy, but I think we're missing some of those motivated moments where we could get the vaccine out of vials and into arms, which is where we need it.
I mean, especially as we push toward trying to reopen schools around the country, if we're going to require frontline workers and teachers to be at work and put themselves at risk, there should be absolutely not a single teacher who has to show up to work who doesn't have access to the vaccine. I do agree that our frontline workers need to be first, but I also agree that people who need the vaccine to do their jobs, and those are not just frontline workers. There are people like teachers, people like law enforcement. They should not, if the vaccine is available, they should be able to go out and get it. And by the way, let me raise my hand and say, if you got one available, I'll take one too. So let's not kid about this. There should, hopefully we'll get to a point later on this year, hopefully this winter, where if there are vaccines available for people who want them. If you want it, you just need to go get it. Hopefully, as we move forward and more vaccines made available and more companies begin to make this vaccine, it'll be available for anyone who wants it. And hopefully, quite a few people will go out and get it.
Okay, and we had a good question in the chat about how to get information to people with low literacy, people who don't speak English, Spanish-speaking communities, and other non-English speaking communities. I know that there would be public health department efforts to some degree, but those are limited. Are you aware of other efforts, or do you have thoughts on how that can happen?
Yeah, I think that's a hugely important piece. Everything must be through the lens of health literacy and really talking to people in the language that they themselves are using to talk about this, which can be hard sometimes coming from a public health standpoint. From the Ad Council, we're going to be making sure to have everything in Spanish language, eventually looking at having some materials in other languages as well, and really trying to make this as available to as many people as possible. And then I think, having a combination of, the written materials on a website, in other places, with video content and audio content where possible, and having that messaging packaged up in a way that you can watch a video or listen to the radio or another outlet to get the information you need.
And Nick, does your messaging include the idea that people have to get a second dose?
Yeah, it's gonna be an important piece for everybody to communicate. It's definitely a nuance of this particular vaccine that it requires a second dose. And yes, so on our website, that'll have information about that, and it's a key piece that everybody should be talking about to make sure people understand.
Sorry, just a point for everybody listening that there have been some requests to see the ad council's materials and scheduling, and to see Susan, the FDA Foundation's research. I think we're going to distribute that by email afterwards, so people can get that way. There was a note also in the chat where somebody said, should the vaccine be distributed like at churches? I know that the way the plans are that I've seen, and I'm no huge expert, has been they'll mostly be distributed through physicians' offices, through hospitals, through pharmacies, commercial pharmacies. Sometimes there are big vaccine centers set up. Jesse, what do you think about bringing it to people at church? Is that too much?
Well, as long as it's being distributed by medical personnel. Believe me, I don't want my minister trying to jab anything. But if we can distribute the vaccine at football stadiums, if we can distribute the vaccines at pharmacies, why can't we distribute them at schools, at churches, at community centers? Why can't we go to where people are? I mean, I personally wouldn't have a problem with the people with the vaccine going to where people are going to be and asking them, will you take this vaccine? So I personally don't have a problem with it, as long as we are not forcing anyone and we are not trying to browbeat people into taking the vaccine. I don't want any minister to say to anybody, take this vaccine or you're going to hell. I mean, we don't want that type of pressure going on. But if we can go to where people are, instead of forcing people to come to where we are with something that is going to save their lives, I don't see the problem with that.
Can I just press you on that a little? I'm not suggesting that people should say they're going to hell if they don't get the vaccine, but this is, at least healthcare professionals would argue that getting the vaccine is not only for yourself, but this is part of your duty as a citizen to further the public good. Should there be some pressure?
Well, of course. I mean,
not just positive, but like, you really should do this?
I would tell you that for anyone who has someone older in their life, that we already know that COVID-19 is having a tremendous effect on older Americans. If you love your grandma, if you love your grandpa, if you love your older mom and dad, I don't see why you wouldn't already get this vaccine. Even if you don't personally want it, I assume you want your older relatives to be around. So yes, there should be. I mean, honestly, as an American who wants to see this country get back to normal, who doesn't want to wear a mask outside for the next 10 years, I want people to get vaccinated so this country can get back to normal, not just to save, but including to save people's lives, but we want our lives to go back to normal. The only way that happens is that people get vaccinated. And if it takes some gentle pressure to tell people it's part of your duty, not only as an American, but as a human being, to get vaccinated, I have no problem with that. But I would have a problem with someone trying to force another person to take a vaccination, especially if in their place of worship or a place of education. Two things that Americans really do love and appreciate.
Susan?
And we specifically tested a message about kind of duty to country and a message about that duty or responsibility to family and people around you. And the latter was far more powerful. The duty to country struck some communities as it was actually counterproductive, but the this could be helpful to my family, to my grandparents, and help us get back to normal, that was very powerful.
Interesting. Yeah, go ahead.
Yeah, I would just say around this question of kind of, how much pressure to apply on people. Certainly trusted medical experts recommending the vaccine is a good idea. I think for people who have concerns and questions, applying pressure to get it doesn't really address those concerns and questions. I think that's the one kind of thing I would raise about that. I think what's important is that people really make sure they're getting informed and getting the right information and getting the answers to their questions before deciding they're not going to get it. And that's a place where we want to make sure that, I think we get the sense this is kind of true across the country, but people realize the impact of this decision and make sure they're getting what they need to get answers before they decide I'm not going to get it.
I find it really heartening that people are looking for facts. In fact, that's a nice thing to see. We have just a couple of more minutes, so I don't know if any of you have pressing things you really want to bring up before we go. If not, I'll go to some more questions. Nobody came off field? Go ahead, Susan.
Yeah, so I'll jump in. I think the idea that the local doctor, nurse, pharmacist can answer these questions means that we have to get the information to the local doctor, nurse or pharmacist. None of them learned about this in medical school or pharmacy school. So we have to give them information, and probably more detailed information, for how did we get to market so quickly? What was the review process? And so that's a piece for the healthcare professions. It's really important to make sure that the members of their profession are armed with that information so they can answer the questions. We don't want them to repeat things that they don't understand or don't believe. They need to learn it to then be able to share and answer the questions.
Anybody else? So I see that some people have talked about, is there any messaging directed towards specifically people who say they don't want the vaccine? Or are we too busy right now dealing with people who do? Nick, do you have anything in the works?
Yeah, that's a great question. I think we realize it's going to be tough to get 100% of this country to get vaccinated, especially early and out of the gates. And I think where we are now, especially in this moment, there's a lot more people who want the vaccine than vaccine is available. And that's why we're seeing, these windows of eligibility. I think eventually, yes, like we would like to reach people. If ultimately they decide they're not going to get it after getting all the information and getting their answers, we know that not everybody is going to make a decision to get it. But for this particular moment where we are now, we want to make sure people are getting answers to their questions and feeling like their decision is coming from a really informed place with the right information. And that's the priority.
Okay, we are just about out of time, so I just want to thank the delightful panelists for being here. Jesse Holland, Susan Winckler, Nick Sugai, I really appreciate your time, your expertise, your energy, and the National Press Club Journalism Institute benefited quite a bit today from your presence, so thank you. I'm going to turn it back over to Julie Moose.
Thank you, Alison. And thank you again to the panel for your insights, and to our partners on the Press Club Communicators team. Thank you all for spending time with us today. As Alison said, we know, we heard, we saw, we read, you're interested in learning more about the research Susan's team did and learning more about the Ad Council messages and schedule. So in a few minutes, probably within an hour, we will be sending you a link to this video recording of the program, and we will also send you whatever information is available on those two things. And we're going to be sending a survey as well. We hope you'll let us know how useful the program was to you, or what we could do to improve so that we can continue to produce programs like this of need and value to communicators and journalists and to the public. We also want to let you know that we have been waiving all registration fees since the pandemic began, at a savings of about $52,000 to participants like you. And so we hope you'll give our work a thumbs up and consider also making a donation to support work like this that we do, so that we can continue to provide it. So thank you again. Stay well, and we hope to see you soon.